Hello and welcome to Nutrition with Vibha. We believe that it is nutrition and lifestyle that creates a positive, sustainable change in health. We talked about why health screenings and health checkups are important. And let's now look at what kind of health screenings and checkups are we to do? What are the different kinds of tests we have to do? And what is the schedule like? What is the frequency like? Let's deep dive into it. In our fast-paced lives, maintaining optimal health is crucial. Regular health checkups are key to early detection and prevention of numerous conditions, including obesity, diabetes, cardiac issues, anemia, and more. Let's explore the essential checkups you should consider. First, obesity. It's a significant risk factor for chronic diseases like diabetes and cardiovascular issues. Monitor your body mass index and waist circumference annually. You can check your body composition analysis also because it tells us about the fat percentage in the body and the muscle percentage in the body. Also, very importantly, the fat which is deposited in the abdomen, which is a very high risk for diseases. Also check your lipid profile every 1 or 2 years and thyroid function every 2 to 3 years or more frequently if required. For diabetes, regular screenings are vital. Fasting blood sugar tested annually and HbA1c every 3 to 6 months if you have diabetes or annually if you are at risk. An oral glucose tolerance test every 3 years is also recommended for those with elevated risk. Cardiac health is essential. Annual ECGs, electrocardiograms, are crucial for those over 50 or those with risk factors. An echocardiogram every 1 or 2 years if you're suffering from cardiovascular diseases is essential. Also, on a preventive basis, a stress test every year or every 2 years can help monitor heart health effectively. Of course, post-40, blood pressure monitoring is essential. Yes, all these tests do seem overwhelming, but when it is planned well and scheduled well, it's not going to be such a big task. We looked at the tests that need to be done for lifestyle diseases. Now, let's look at some tests to maintain our health of some specific organs like the bone, looking at blood health or preventing anemia, as well as gut health and some functioning of key organs like the kidney and the liver. Anemia can cause fatigue and weakness. A complete blood count that tells us about the hemoglobin content is to be done annually, and tests for serum ferritin, iron levels, vitamin B12 and folate every 1 to 2 years is essential. In the Indian context, every year, serum ferritin and iron levels will be good. For bone health, a bone mineral density test every 2 years, especially for women over 65 and men over 70, is crucial. However, considering the bone disease coming in a little earlier, post 40, definitely every 2 years the checkup should be done, and if it is post 50 or menopausal women, then every year it's a good checkup to have. Annual checkups of calcium and vitamin D are recommended, especially vitamin D, because currently we are seeing an increase in the vitamin D deficiencies, and that causes many other diseases like diabetes, low immunity, cancers, and so on. Maintaining gut health is vital. Annual stool tests and colonoscopies every 10 years, starting at age 50, or more frequently if there is risk, is important. And for looking at the gut health, a hydrogen breath test can be done if the symptoms are there. Regular screenings for cancers are life-saving. Mammography annually for women over 40, pap smears every 3 years for women aged 21 to 65, and PSA tests annually for men over 50 are crucial. PSA is prostate-specific antigen test. Liver health is essential. Annual liver function test and ultrasounds or fibroscans every 1 to 2 years for those who are at risk, especially those who have diabetes, obesity, hypertension, sleep apnea. With these kind of conditions, a fibroscan every 1 to 2 years for those at risk will help in detection. Hepatitis panels are also important for those at risk. For kidney health, annual blood urea nitrogen and serum creatinine tests are vital. Regular glomerular filtration rate tests and urine analysis help monitor kidney function. And this is essential for people with long-standing diabetes or uncontrolled sugars. Inflammation increases the levels of risk of diseases as well as the disease itself. So if you want to maintain health, we have to keep the inflammation low. Monitoring inflammation through annual C-reactive protein test and erythrocyte sedimentation rate test can give us insights into overall health. Yes, Health screenings and checkups are the cornerstone of creating good health. Once we get the results of the test, head on over to the healthcare professional, discuss the results, and see what corrective actions we need to take. You must visit a nutritionist because with the right nutrition and lifestyle choices, it helps to go a very long way in preventing issues and maintaining health. So the more health empowered we are, the better our actions will be because we know we need to take charge of our health. Don't forget to like our video, subscribe to our channel. In our blog, we have information and we have a whole lot of recipes that you could incorporate into your daily routine. So stay empowered, stay nourished, stay blessed.